So guys, this is Iyaniwura, and she's the anchor, the CEO, the COO, the everything of Safe Haven Community. She's a senior clinical research
I
nurse.
don't even know how you came up with that title, but it's okay.
And she's an amazing woman, everything. I will allow her to introduce herself now, so we can just get started because we've wasted
Yes, we've
12
wasted
minutes.
15 minutes.
So
Almost
let me allow
15
you
minutes.
go for it. Good evening. Thanks for joining me.
Thank you so much, Mutirade. I know that this was a bit last minute, but we'll do it anyway. Hi guys, my name is Iyaniwura, and I'm the community lead at Safe Haven
I'll
International.
type that for
We
you.
pretty much support international educated nurses and midwives to thrive in the UK. So, if you're an internationally educated nurse or midwife watching this and you need some sort of support, we run monthly webinars, we run live sessions, there's coaching, mentoring available within the community. So, if you're struggling and you feel like you need a bit of help, you need a community that can support you, that will listen to you, that will give you, a soft landing in the country, that place is the place to be. So I'm so happy to be here, Mutradi. Thank you so much for inviting me.
So, thank you so much. She's done a bit of introduction. Yeah, I want us to talk about clinical research nursing. You know that a lot of nurses, they keep complaining that, oh, they are burnt out, they are leaving nursing. In fact, I think there was a ruckus pocus on Twitter, yeah, about people sharing negativity, this and that. People want to leave nursing. I leave nursing. I don't want you to do nursing. And I always tell people that, okay, even I myself have considered leaving, but then I'm like, before leaving, have you tried other things within nursing? Maybe it is where you are that is training you. I mean, it's training you out. Why don't you try other specialties in nursing? There are numerous specialties, and that's why your specialty piqued my interest. That okay, I know that a lot of times you are at home working and you're shining, you're glowing. It's obvious that you're chilling.
I'm not chilling.
So I said, okay, let me bring you on. Let's
I'm
have this
chilling. I'm
discussion.
walking.
How? How do I become? I'm a theater nurse, right? If I as a theater nurse want to become a clinical research nurse, how do I start? What do I do? What are the
Easy
requirements? How do I
peasy.
go about it?
Easy peasy.
Mhm.
Very
So
easy.
let's have it.
So I think that two things can be right and wrong at the same time. And I think that a lot of nurses are not able to detach from their licenses. Does that make sense?
I don't understand.
Your bachelor's in nursing degree is one thing. Your license to practice as a nurse, as a registered nurse, is another thing. And I think the issue that I think a lot of nurses have is that they feels like they can't separate the two. So they think my nursing, my license, everything are collabo. No, everything is not collabo. Your bachelor's nursing degree itself, as a standalone, is huge without the license. There are so many opportunities outside of the registered nursing, outside of the nursing bedside, when we want to even, is huge. When we want to divide the clinical that you need your license to practice, and also the non-clinical that you don't need your license to do, they're both huge. And there's so many opportunities in both worlds. The only issue is you just need to be able to find those platforms or find those opportunities and explore it. Now, for somebody who is watching this tonight, I don't want to, because like I said, it's huge. So I want us to focus on the topic for today, which is around the clinical research nursing space. Now, Mujirade gets this wrong all the time because I'm not a clinical research nurse. And I've told
Now
her
you're
this so many
embarrassing me in
times.
front of
I've
everybody.
told her this so many times, but she has coconut and she doesn't listen. I don't work as a clinical research nurse. I work as a clinical research project
Ah,
manager. So I
okay.
work within the clinical research space
Mm-hmm.
as a project manager. So my role is completely different from the role of a clinical research nurse.
Okay.
I have done clinical research nursing before in the past, but that is not what I do currently. And that is why I'm saying that I can literally function in both worlds because I work with clinical research nurses
Mm-hmm.
and I can still tell you how to become a clinical research nurse if that is what you want to be, you know. But again, if you want to explore the non-clinical side of the clinical research space,
Mm-hmm.
that is also possible.
Mm-hmm.
Now, I'm going to speak on the clinical research nursing space. Now, a lot of people wonder, how do I become a clinical research nurse in the UK? To be fair, you don't need a lot. A lot of trusts have different criterias for clinical research nurses. Some trusts even call them clinical research practitioners. Some trusts will call them clinical research assistants. Some trusts, there are different roles within the clinical research nursing space
Mm-hmm.
within the NHS itself. One of the things you need to think about is, first and foremost, you don't need a master's to become a clinical research nurse. One
Interesting.
of the things I would say start with is go on NHS websites, Google search for clinical research nursing, clinical search for clinical research nurses role or clinical research practitioner. You will see that a lot of roles will come up at either band 5 or band 6, band 7, and even band 8. And each band has different requirements. For somebody who is branching out from the bedside into the clinical research nursing space
Mm-hmm.
as a newbie,
Mm-hmm.
I would advise that you start as a band 5 or a band 6, which means that if you're starting at band 5, they honestly don't require a lot. They would ask you if you have your normal, if you've got experience as a nurse, if you're passionate about research, if you have your GCP certificate. Now you can do a free GCP course on the NIHR
And
website.
what's that?
NIHR. I
What's
can't remember the full
GCP?
name. Yes, it's called a Good Clinical Practice Certificate.
Okay.
So it's a whole course and it's free on their
Mm,
NIHR website.
okay.
Yes, it's free.
Mm-hmm.
I think the course, if you sit down with it, you could finish it in a day.
Mm.
The course, I would advise anybody who wants to go into clinical research nursing to please look at that course because that course breaks it down for you. It tells you the bits and pieces, the nitty gritty of clinical research that you need to know.
Mm-hmm.
That is the basic certificate that you need to get into the clinical research nursing space. Now, clinical research nursing is also huge, right?
Mm-hmm.
There's upper GI, there's cancer, there's obesity, there's diabetes. Think about any disease out there. There is research for it and there is research going on, so which means that they need nurses in every department where they're running research. So if you're a midwife, there are research midwives as well, so this is just not only nurses. There are research nurses in
Mm-hmm.
pediatrics, there are research nurses in midwifery, there are research nurses in acute setting, there are research nurses in your cancer department, there are research nurses everywhere in your trust that you can think
Mm-hmm.
of. So like I said, if I would start, first of all, go and do that course. Go and do that NIHR
Mm-hmm.
course. Now, the second thing that you probably need to probably start thinking about is, where is the research department in my trust? One of the things that I've advised people to do in the past, and it's worked for quite a lot of people that have come back to testify to say, Fair, that method worked, is I ask them to approach the research department in their trust, in their local trust, to say, introduce yourself. tell them your intentions. You're interested in research, you're a nurse, you've been
Mm-hmm.
working in so and so ward for the last 3 years, but your intent, do your homework as well. Don't go empty handed. Don't go without nothing. Do your homework. You need to know the department that you're going into. If you're interested in cancer research, if you're interested in diabetic research, if you're interested in obesity, do some homework. Understand the different layers, understand the type of research that your trust engages in.
Mm-hmm.
So, not every trust will do obesity trials, not every trust will do migraine trials, not every trust will do rare diseases. So, you need to do some sort of homework to understand the type of research that
Mm-hmm.
your trust does before you go to engage them. Because when you've done your homework, it tells them that you know exactly what you want and you know exactly what you want to do.
Exactly.
Does that make
Right.
sense?
Mm-hmm.
So you need to, so if your trust only does maybe, if your trust is popular for, let's say, cervical cancer
Mm-hmm.
research, or let's say ovarian cancer research, or just general gynae research,
Mm-hmm.
I'd say just do your homework around that,
Mm-hmm.
and also check if it's something that you like. Because I've also seen people get into
And they're like,
research and they hated it. Exactly. And they hated it because people just want to leave the bedside, but the grass is also not greener on the other side, right?
mm-hmm.
The fact that you ate something doesn't mean you have to then jump into anything else that you can
Mm-hmm.
find. You
Mm-hmm.
need to jump into something that is worth the while.
Mm-hmm.
You need to jump into something that you absolutely enjoy,
Mm-hmm.
because that is the only way you can get job satisfaction.
Mm-hmm. Mm-hmm.
You need to also look at the pros and cons. Can I work 9 to 5? Does my family
So
commitment
you
right now
so you
allow
do nine
me?
to five.
Yes.
Um,
So clinical research nurses work 9 to 5.
okay.
They don't work
Okay.
weekends. They don't do bank holidays. Can I let go of not earning out of social hours? Great.
Mm-hmm.
Because that
Mm-hmm.
is also what you're going to lose. You're going to lose working out of, because you're not going to work bank holidays. You're not going to work nights. It's strictly 9 to 5, Monday to Friday.
Okay. And you can decide to work on from home.
That is also tricky. So the
Okay.
reason why I'm able to work from home is because, again, I don't work in the clinical side.
Mm-hmm.
My role is a strictly home-based role,
Okay.
where I just go out on site maybe once a week or once in 2 weeks.
Okay.
Do you see
Oh,
my
okay. That's
point?
important. Yeah.
So,
Yeah.
but that being said,
Mm-hmm.
it depends on the trust. I don't want to promise anything here and then you go and find out that, what if I said 2 weeks
It's
ago is
different.
not true. So
Yeah.
do your due
Mm-hmm.
diligence. The NHS right now, they are pushing back on home working.
Okay.
So they're not so, especially because COVID is now, of course,
I know,
everybody
right? It
is,
was COVID
they've
that brought all
literally,
the whole virtual thing.
exactly. So they've literally asked everybody to come
Mm-hmm.
back. But I also know trusts that are still allowing people to work from home. I know clinical research nurses that work remotely twice a week. So they go
Okay.
into the office 3 days a week. They work out of office, because as a clinical research nurse, your role is patient facing and also non-patient facing, because you're seeing patients, you are the one enrolling people onto those trials. That's
Mm-hmm.
your role as a clinical research nurse. Your role is to speak to people about the trial
Mm.
that you are working on. So you're still going to see your run clinics. You will run clinics. You will sometimes administer those medications to them.
Mm.
Yes. Yes, you will administer those medications to them, provide support for them, refer them
Mm-hmm.
to other medical professionals if they need it. And then, of course, you have the admin side of things, which
Mm-hmm.
is the data entry side of
Mm-hmm.
things.
Mm-hmm.
You know, if you work in a trust, again, different trusts run differently. Some trusts have like clinical trials assistants.
Okay.
There are clinical trials assistant help them to do the admin side of things, which means
Oh.
that things like data entry, because of course, for every clinical trial that is running in every
Mm-hmm.
trust, you have to enter data for the sponsor of the trial to see it. Does
Oh,
that
I
make sense? And
understand.
that data entry is a lot of
Mm-hmm. So
work.
you need the assistant to come in there.
So, but some trusts don't have assistants.
So you
Some
do all the
trusts, it
job.
is the clinical research nurse that does everything.
So at the end of the day, you think that sometimes you think that, oh, leaving the bedside is going to be easy. Yeah, maybe not as back cracking
I
like
mean, it's
bedside
not
nursing,
back
but
cracking,
mm-hmm,
it's not. A lot of the conversations is you're in an office, you're liaising with the PI, you're liaising with the sub-Is, you're liaising with the project managers, you're liaising with the sponsors, you're holding meetings, you're attending
mm-hmm,
MDT meetings.
mm-hmm,
If they call you that, oh, we have a potential patient in Ward 28, you're running to Ward 28 to go and speak to that patient
mm-hmm,
and maybe get them to sign the consent forms. Do you understand? So honestly, it's not backbreaking like
mm-hmm.
bedside. It's not.
Interesting.
Most of your job is very, you're pretty much in control of your own tasks.
Autonomy.
Yes, you got a bit of autonomy on
Okay.
they give you portfolio.
Okay.
You run it, but you also have to deliver,
Mm-hmm.
because if you don't deliver, your band 7 is going to be looking at you like, what's going on?
Okay, so we've looked at what it is, the clinical and the non-clinical
Mhm,
side. You've also talked to us about the requirement, which is basically you're interested.
mhm,
You have your nursing diploma, you have your
mhm,
degree
mhm.
sufficient, and then you encouraged us to go to NIHR, which I believe is National Institute of Health
Health
Clinical Research.
Research, National Institute of Health
Yeah,
Research, yeah.
and you said you should just search for the GCP
Good
course
clinical
and hmm,
practice course. Good
good clinical practice.
practice, yeah.
Good. So good clinical practice course. Let me, because someone asked about it earlier. So good clinical
Practice course. For some reason, I can't see your
practice.
comments. I can't see the comments from my end.
Eh.
I can only see,
Me.
yeah.
Hmm. I don't know why. Maybe that's a new thing because Instagram keeps updating things I did
Yeah,
not
they
send
keep
them.
doing all sorts of shady things with
I come and
their.
I'm like, why is it looking like this? So in the next 2 seconds, what happened
I know,
again?
I know.
So good clinical practice course and you get a certificate and it's absolutely free.
It is free.
Yeah. And then after you're done with it, you said you can even do it at your own pace at home within
Yes,
one day,
yes,
which is
yes,
good.
yes, yes.
And you
There are
get it,
also,
you go to
there are
NHS
also,
website, okay?
yes, there are also roles that are actually not, you don't need your license to do it.
Mm-hmm.
Data managers in the
Interesting.
NHS, clinical research assistants, there are all these roles are band 5, band 6 roles that you honestly don't need your license to do. If so long as you're a registered practitioner, you have interest in clinical research, again, you can volunteer.
Mm-hmm.
That this is a method that has also worked for people
Mm-hmm.
that I've mentored.
Mm-hmm.
Volunteering in your research department, just give them 6 hours a week of your time. Because if a role comes up, you're the first person they're gonna call.
Okay. And this thing that for me to think of volunteering there, on an average, what's the salary like compared to the no to all nurses on the bedside or in the theater?
Okay, so like I said, within the NHS is banded,
Mm-hmm.
and most of their bands are, so for like data management roles they are lower
Okay.
bands. They're usually band 5,
Okay.
band 6 at the most.
Okay.
But band 6 is like a senior data manager. So it
Mm-hmm.
means that you must have worked as a data manager for like maybe 1 or 2 years
Mm-hmm.
before you can move up to like,
Mm-hmm.
that. Now, and of course, band 5, I think band 5 in the NHS now is 27, isn't it?
Things around
Yeah,
that.
20. It starts at 27 and
Mm-hmm.
ends at 32. And most band 6 roles, most clinical research nurses role
Mm-hmm.
in the NHS actually start from band 6.
Mm.
The trusts that are offering band 5 clinical research nursing roles, I look at them with very, very side bombastic eyes, because I feel like that is just them trying to cut
Mm-hmm.
cost, and it's not fair because
Mm-hmm.
you are offering a specialist role at band 5. That's
Mm-hmm.
shady. But then again, if you want to climb up that ladder, you can easily. So I can have this conversation with both corners of my mouth.
Mm-hmm.
I don't encourage people to go for such roles, but then again, going for such roles is also not a bad idea because you can do that role in 6 months and and progress to a band 6, which you probably might not be able to do on the
Now
bedside.
that
Do you get what I mean? So
mm-hmm.
it depends on where you are,
Okay.
and it depends on how desperate you are to get out of the bedside.
Okay.
If you're not desperate, I'll say just give it, wait, keep applying for band 6 roles. If you really want to leave, leave, leave,
Mm-hmm.
leave, leave, if you see any band 5 clinical research, just go for
So
it.
one
You can.
second, guys. 1 second. 1 second, guys. So I've been seeing some questions on the screen,
Okay.
and I might not be able to get them out. So guys, please, you know the way we do it. Maybe it's your first time. If you're watching this on your phone, right, on the bottom right corner of your screen, on your right side,
Yes.
you see four
The
icons. So
questions there.
you see the icon that has a question mark. So just input your question there. That's where I will read the questions from,
Mm, mm,
because it might
mm.
be impossible to be scrolling on the screen. Okay, so please just put your question there,
If
and please let's stay on topic, so that, because I might not answer questions that are not related to this topic,
this
and we're
topic.
rounding up soon. So please put your questions in there now. And so I have a quick question. Yeah, before we talk about, okay, before I ask my question, what are the other non-clinical roles that you can recommend to internationally educated nurses? Yeah, they are trying to navigate within the
Mhm,
system. They're
mhm,
tired of the bedside. Well,
mhm,
they're like, okay, we did take me here, we did take me there.
mhm.
So what are the roles that you can encourage them to go through,
Outside
that
of
they
the
will grow
NHS.
in?
Okay.
It could be outside of the
Okay.
NHS, off
So
bedside,
off bedside now.
non-clinical.
So
Yeah.
for international educated nurses, this is a safe space I can speak freely.
Mm.
I always say that it's hard to pivot into those roles if you don't have the ILR,
Oh, okay.
because most of those roles are not sponsored.
Okay.
You understand? So
So
I
you
would
won't get
say
COS.
exactly. So you won't get certificate of
Interesting.
sponsorship. The place that is quite easy for you to get certificate of sponsorship right now is still within the NHS.
Okay.
So I always say that if you're long term, you need to plan your future now, right? You need
Mm-hmm.
to plan that 5 years runs quickly. Ask
Mm-hmm.
MJ, it goes quickly, isn't it? So you need to start thinking ahead
Mm-hmm.
to say, if I want to leave the bedside in the next 5 years, what do I need to do? Getting into clinical research nursing will definitely help you to get out of into non-clinical roles quite easier.
Okay, what about
Does that make sense?
what about independent of clinical research
So
nursing?
in
Are there some other roles that are
there are
independent? So I'm leaving.
there are
So
there
I'm
are
leaving clinical
there are
research, and I'm saying
oh gosh,
other non-clinical roles
there are
apart from
there are
non-clinical
but
research.
you also need to you need to plan that. You need to plan that exit very well, because you can't be working bedside for 5 years
Mm-hmm.
and you
Mm-hmm.
get your ILR and then you want to jump out into a non-clinical bedside role like that. I don't know. I don't, again, does it work for people? Yes, some outliers, but does it work for the majority? The answer is no. So there are a lot of non-clinical. There's the 111
Oh, yeah.
service. There's
Yeah,
the
I have a friend who
yeah,
just got on that, but she's
yes,
gotten an
yes,
ILR. That's why I'm like,
exactly. They
okay,
don't
let me
sponsor.
wait for you.
They don't
Let me wait for you to
sponsor.
land.
There's the
So that might
one
be what
yes,
made
the
it
one
easier
woman
for her.
service is good
Mm-hmm.
because they also work
Yeah,
remotely,
she does work remotely.
and the pay is good as well. They
Mm.
pay them really
She's
good,
been pushing
especially
me
if you're
to
working
come.
with. Again, the only problem that I have with such again is there's no real progression. You can't. It's that job or you move into something else. So a lot of my friends that are doing it are already AMPs. Do you see?
Mm-hmm.
So
They're already
even if
up there, so they're
they're
just
already
chilling.
up there, so they're just chilling, so they can move around.
Mm-hmm.
So, and that's why I said planning, you need to be strategic in what you're doing and the way you're going to do it, right? So there's a one-on-one service, there's occupational health, there's telemedicine,
Mm-hmm.
there's within the pharmaceutical space, gosh, there's so many. I can't even, there's medical writing, there's clinical research project managers, there's trial managers, there's clinical trials assistant,
This is plain to you. I cannot keep up.
there's a
You
lot.
write it for me behind the
Honestly,
screen.
there's occupational health, there's clinical advisors, there's a lot that you can do. But I always say you need to keep an eye on the ball. You need to start researching, what do I need? So when ILR comes, so that when ILR comes, you are not scrambling, you are not, you know, running kitty kitty. I've been telling my girls in my community that are already clinical research nurses that
Mm-hmm.
after ILR, you guys are moving. You're definitely moving out of clinical research nursing into clinical non
The
clinical
clinical
research
part.
roles.
Yeah.
Do you get what I
So,
mean?
and
Because
the reason why we're
they're
talking about
already
ILR.
clinical research
Mm-hmm.
nurses, it's easy for me to pivot them
Mm-hmm.
to help them build that ladder to move
Mm-hmm.
out into
Mm-hmm.
the pharmaceutical space.
Mm-hmm. And the reason why we keep talking about ILR, for those that might be wondering, is that you know that a lot of international nurses, you need
That's
sponsorship, except you
sponsorship.
are a dependent. If you're not a dependent, you need sponsorship to
Mhm.
remain in the UK for
To
5 years.
remain in the
But
yeah.
once you have your indefinite leave to remain, that's your
You can
ILR. See,
do
you can
anything.
even call your employer, hello, I won't be coming back to your workplace. You can
Exactly.
keep you can keep your
Can
job. I don't want
fly.
it anymore.
You can literally fly.
Because
The
you're your
sky is the
sponsor
limit
now.
from
You don't
there.
need
Yeah.
their work. You don't need their
Yeah.
sponsorship.
The
So yeah,
kind
that's why
of
she's.
jobs you will be looking
Mm-hmm,
for will be totally different.
mm-hmm.
Totally different.
Oh, beautiful. Have I missed anything?
I, I don't think so.
Okay, so we've talked about everything literally.
Mm.
Requirements, salary, non-clinical roles, blah
And
blah
most
blah. I think we've touched
the
everything.
salary outside of when you branch out into non-clinical roles
Mm-hmm.
outside, and the average trial manager outside hands, most of them, their starting salaries from like 65K upwards. You can Google it. You can
Why did
Google
you call
it.
them again? What's their
Like
name again?
even clinical trials, like even clinical trials coordinators
Mm,
in the in like the CRO
mm-hmm.
space, most of them, their salaries is starting from like 30, 35 upwards, depending on your
Interesting.
that, and that is clinical research coordinators are like the lowest of the lowest within the space. They are. So you can imagine how much medical writers, regulatory affair coordinators,
Mm-hmm.
how much they're earning. And most of those jobs, you only need a life science degree, and nursing is a life science degree.
Interesting. Have you heard anything about nursing informatics? Nurse
So
informatics. That in itself is
nurse
cutting my teeth.
informatics in the UK
Nurse
is quite
informatics
new.
is tabi.
Nursing
The
informatics.
thing
So
is cutting my teeth. Mm-hmm.
nursing informatics in the UK is fairly new. So it's I have heard of it. I know quite a lot of private organizations are employing nurses who have experience in data sciences and all of those things. But like I said, it's fairly new.
Mm-hmm.
The only thing I'll say to you is don't go and do masters in nurse informatics because you think it will get you a job as a nurse informatics. Except if you have money to waste, sure, but it won't.
That one, Tev, is inside though.
It won't.
It's inside. There's some things that you don't need to
But
go and do masters on.
ah, you
Just get a
don't need
training of maybe
just
50
get
pounds or 100
training
pounds.
exactly.
Some are
Just
even
get to
free.
some are even free.
Okay,
You
beautiful.
say go and do your Prince 1, Prince 2 instead,
Interesting.
instead of that. So
Okay, beautiful. Let's look at some questions before we round off because, oh my God, we've eaten into the time. So, add 234 said, For someone with a BSc in health, well-being, and social care with no nursing degree, what kind of question is it? Anything for healthcare assistant or support worker in health and social care management, and what's BS? Let me move to another question because I don't understand this question. It's pieces. Okay, faithful. Can we work? Can we work as bedside nurses? Why still volunteering in research units as a research
You can.
assistant?
You can. So the reason why I inserted that volunteering
Mm-hmm.
thing is so that if you're interested in research, right, and you're you're finding it difficult to get a job as a research nurse, one of the easiest ways to get in the door
Mm-hmm.
is to introduce yourself to your research unit. Again, do your homework, understand the kind of research they're doing
Mm-hmm.
before you go in. Give them your CV, give them your experience so far, and let them know that you want to learn, you want to engage with them,
Mm-hmm.
that you can come in 4 hours a week to volunteer. Help them pack papers, help them follow them to speak to patients, just to see and
That's really
understand
nice.
what they're doing.
Mm-hmm.
That way, you're building a relationship with them, and then, of course, like I said, if anything comes through the door, they will definitely put you forward for the job.
Nice. Thank you. I hope we answered your question, Faithful. What certifications can I do to boost my CV for outside bedside roles? That's from Mimi Chuku.
So, again, that's a very vague question because outside of bedside is huge.
Mm-hmm.
He's massive. So you you need to understand, you need to know what you want to do. Do you want to be a diabetic nurse specialist? Do you want to be a research nurse? Do you
Mm-hmm.
want to be a palliative nurse specialist? Do you want to
In
work
theater.
within within the theaters? Do you want to go and become a nurse advocate? Do you want to go into occupational and
Or nurse
well-being?
educator.
Do you want to become a practice educator?
Mm-hmm.
What do you want to do? Do you want to do ICU? Do you want to become an outreach nurse? So outside of bedside, on top of my head, I can list 50 things for you. Do you want to become a mental
You
health nurse?
need to pick what
The
you want.
list is, so don't just go and be doing courses, please. I beg you guys. Don't, it's a waste of time.
Mm-hmm.
You need to narrow down exactly what you want to do
Mm-hmm.
and what you want to be before you start doing those certifications. I'll tell you a story. There was a lady, I used to run like free, I used to do those things, Mujade, where I'd run like free
When we had time.
one-to-one sessions when,
Kusai,
but now
right?
time no day. I'd run free one-to-one sessions. And I remember one lady vividly. She
Mm-hmm.
wanted to become a diabetic nurse specialist and she didn't know how to go about it. So I said, let's go on the ILH website, which is
Mm-hmm.
the database for where everyone who works in the NHS has access to all the trainings in this NHS.
Mm-hmm.
I said, let's go on that website. We looked at about 10 courses. So first of all, we went on NHS jobs. We looked at all the diabetic nurse specialists and all the requirements they were asking for.
Mm-hmm.
Most of the band 6 jobs there just wanted somebody who has worked with diabetic patients and also have, I think, one certificate in like diabetes, something, something, something. And I said, okay, good. Let's go on that ILH and look for that course. She did that course. We repackaged her CV. She got a job within six
Mm-hmm.
months as a diabetic. I don't know where that baby is now, to be fair. But
Oh.
she came back to tell me that, oh, Auntie Fair,
Mm-hmm.
I got a job as
Mm-hmm.
your method worked. And I was like, oh, thank you. Do you understand?
Mm-hmm.
So she's like, for her, she was so shocked because she was like, I've been trying to figure this out for 2 years. Do you get
Wow.
what I mean? Like, I've
Interesting.
been trying. She said, I've done this. I've said, no, what are you doing? You're wasting your time. Let's go. Let's look at the
Mm-hmm.
requirements of the job you want to go for.
Exactly.
Then you have to tick, do I have these requirements?
Mm-hmm.
If you don't have them, then you now have to look, okay, how do I get these
I
requirements?
remember when I was looking for when I wanted to become a band 7 manager. And I told you that, yeah, I do think I'm ready because I'm always asking. I know you to believe myself sometimes. I'm like, am I even ready for this thing?
You're ready.
And,
And I
and the
told
first
you,
thing I did, And the first thing I did was I went to NHS website because people kept saying you need masters, you need
You
master.
don't
Even
need
my mentors were
masters.
saying,
You
even
don't
my
need
mentors were
masters.
saying you need master. Saying master, I'm not ready for
You
masters. Do you
don't need
understand?
it.
The only masters I'm ready for is master's bedroom for now. So I went to the NHS website myself and I'm like, okay, I even want to see what they are
Don't get me
requiring for
wrong.
this
There are
thing.
some roles that you definitely, but they will state
Of
it there. So go and check
course,
first.
of
Don't
course,
rely on, they said this. Don't rely on
you
what
need
even
to
me and Mojade
do
is saying
your
right now.
own research until I went
Don't
to the website
rely
before I
on,
saw it
oh, that this
that
person is
I
a
don't need masters.
no.
Some trusts said they wanted masters,
Some trust will
but I
say,
saw the one that said they don't.
some trust will tell you that. So what people don't understand again about
Mm.
the NHS is that Northampton Hospital is not the same as Watford General. They don't have the same requirements for their roles. One hospital will tell you that we need this, and that for
Mm-hmm.
the same role.
Mm-hmm.
Another trust will tell you that they don't need,
But
they
they
won't
want
even put it in there.
interest
They
in maybe you
want
want to do
it.
it. Are you
They
interested in getting
are
the
you
training
interested
later?
in getting the
You
training
know,
later?
you
Are
have
you
to know
interested
what
in
you
it?
want. So
So
I
you
hope you've
can't.
answered Mimichuku. You've over
Yeah,
answered
I
Mimichuku's
think I
question.
have answered
Narrow
her.
it down,
Narrow
get
it
to know
down.
what you really want,
Yeah.
and
Then once
follow
you've
a
narrowed
method.
it
That's the
down,
method.
then you
Go
can come
to
back. We
no.
can have a
Mm-hmm.
conversation.
Mm-hmm. That's the method, you know. You have to know actually know the exact thing you want. The next question here is we will soon round up. I might not be able to take all the questions. But let me see. Let me see another one that is related to okay. So clinical trial nurse role. I guess she's saying that is it different from nurse researcher role? How can one be a clinical trial nurse? Did you hear me?
I'm looking at that question.
Yes.
Can you say it again?
Okay, she said clinical trial role. Is it different from clinical trial nurse role? Is it different from nurse researcher role? So if it is, then how can one be a clinical trial nurse?
I don't understand what she meant by clinical trial, but maybe if you're listening to this, maybe you can rephrase your question. So, clinical research is the same as clinical trials.
Okay.
So they just use the words interchangeably. Clinical
Okay.
research is like the fancy or generic word that a lot of people just use, but clinic is the same thing as clinical
Okay, so
trials.
we are good then.
Your clinical research department is running a clinical trial. Does that make
Okay.
sense?
All right. Good.
So
Okay.
yeah, a
And
clinical trials nurse is a clinical research nurse. Yes.
okay. And Becky Chiavsi, I hope you answered your question, nursing with Pressy. Becky Chivatsi said, when volunteering, do you use your paid work time? Yeah, you use your
Yeah.
week, you
No,
use
no,
your work
no.
time
You
or
use
your
your
annual leave.
free time.
Sometimes
You use your free, so you have to do it.
unpaid.
You can't do it in your paid time though, because your manager and your ward will not give you time to go and be.
Hmm.
You are leaving their ward now. You think they will give you time to go and
So
be
you have to sign
gallivanting with
up
them.
for
So you
unpaid.
have to literally do it when you're off work. So if you're
Mhm.
working Monday, Tuesday, Friday, Thursday, Friday, you probably just have to go there on the
Good.
Wednesday to do your
Good.
volunteer.
Okay, and then the
You're
last,
volunteering.
yeah, exactly. So yeah, it is what it is. Let me see. So I have True Boy 845 said I have a pharmacy background. I have worked with some of the big pharmaceutical companies. Great in the past. And I'm currently a newly qualified nurse. Amazing. How can this experience fit into the clinical research nurse role?
Fits in perfectly. It fits in perfectly because you've got pharmacy background, but then again, when you say pharmacy background, is it within research? So
Or is
that's another
this sales
question
rep?
because, or sales rep, exactly, because pharmacy is
Mm-hmm.
huge as well.
Yeah.
So it depends on, I don't know what your background is within that space. So you need to then narrow. If I have more in
Mm-hmm.
depth, I can maybe answer that question. But I hope this answers the question. Like it depends on your experience. If you've got research experience, if you've got research background, of
Mm-hmm.
course, adding that to your CV is fantastic.
There's this question here. Thank you, Sister Ife. I hope we answered your question a bit here. And Adrian 001 said, I'm a final year undergraduate nurse in India. I also have clinical research experience in Canada. Wow, beautiful.
Wow.
I went to the NIHR webpage now. On point. Like it's going to work straight up. Yeah, I saw different opportunities which I'm interested in. Great. Can I apply for more than one of them? Or am I restricted to one?
You can.
Restrict
Again,
case.
I always say that
Mhm,
just look at the job description,
mhm,
look at the requirements. Do I have the skills? Do I have the This is the question you need to ask yourself. If you look at
mhm,
a JD, they will tell you exactly what they're looking for. They will tell you
mhm,
we need somebody who has degree in this, we need somebody who has this, we need somebody who has 5 years experience of monitoring,
mhm,
4 years experience of this. Tick those things off. Do I have this? Yes. Do I have that? Yes. Do I have that? Yes. Do I have that? Yes.
mhm,
If I don't have one, okay, can I get it?
mhm,
How can I get? So those are the questions that you need to ask yourself. So yes, you can apply for different things on that website, so long as you have all the skills, the qualifications, the experience
mhm.
that they need in those job roles. Why
Okay.
not?
And exactly. So thank you. I want to ask this one or two question. Yeah. What are the common interview questions? Like maybe a few, like it's most commonly asked during an interview
For
for the
clinical
clinical
research
research role.
nurses,
Mm-hmm.
I think the most commonly asked question is about around informed consent.
Okay. Informed consent.
And the most commonly asked question again is also around data entries and your experience as a research nurse. That's why I said you need to do that training, because when you do that training, there's a lot of questions in that training that if you do it, when you go in an interview, you can't go wrong.
Okay, that's the GCP course, the good
A good
clinical
clinical
practice.
practice.
Good.
Course.
And my last question for you is, can an internationally educated nurse coming from right from maybe let me say Africa generally, or maybe India, internationally, sure.
Mhm.
Can they apply from their own country for a clinical band 5 clinical research nurse role?
That would be hard, because remember that in order for you to, except if they have UK PIN,
Okay.
does that make sense? And I'm
They,
assuming they don't.
okay.
Do you get what I
If they do
mean?
for us, do they sponsor? Do they provide
Mm.
sponsorship for band 5 clinical research role? No. So
Pre-reg, pre-reg.
no, for internationally educated nurses, not pre-reg, someone that is already a nurse from another
But that lives
country.
abroad.
Yes.
But that's what I'm saying. If you're
Mm-hmm.
an international educated
If you've
nurse
not registered
that
with
lives
NMC.
abroad, if you've not
Mm-hmm.
registered with NMC, you're not a UK nurse.
Okay.
Do you
So
get what
that's
I
the
mean?
registration you're talking about.
So that's
Okay.
the registration. So it means that you now need to look for a job that will sponsor you as a pre-reg
Mm-hmm.
nurse. But unfortunately, those kind of jobs are not available
For
on the
clinic.
pre-reg route. Do you see my point?
Okay.
So
Okay.
you will probably then have to come into the UK as the
Mm-hmm.
pre-reg and do your OSCE and then pass before you can progress into becoming a clinical research nurse.
But it is not impossible.
I mean, it's not impossible, but I've not seen any where they're sponsoring directly into clinical, because even band 5 is very rare for you
These
to see
days.
band 5
Okay.
clinical research, because they're specialist
Mm-hmm.
roles, you see. So most of them are graded at band 6 upwards.
Thank you so much. It was an amazing session. I just kept me like this. And my
I
book is
hope it
full.
was good. I hope it was good, and I hope that
I
you
picked a lot. I learned a
yes,
lot. I refreshed. It was a very refreshing session for
advert.
me. I don't know about my audience. And I think they kind of enjoyed it too because the engagement in the comments is really
Yeah,
fantastic. So thank you so much
I
for your
didn't see
time.
all the comments.
Ah,
Weird.
I don't know why, Sha. I don't know what Instagram have done,
And
but yeah.
I can't see it. It's weird.
So there's a lot of engagement in there. We can't talk about
Can I
everything. Yeah.
plug the? I've got a webinar coming on the 31st.
Please,
Can I plug
right
it?
away.
Okay,
Right
so
away.
guys,
Mm-hmm.
like I said, if you're an internationally educated nurse and midwife in the UK, join the community. community, because if you join the
I'll type it
community,
again. Safe
we
haven.
host,
It's on
yeah,
the
we host
flyer, guys.
webinars.
It's on the flyer. The
Thank you.
community is on the
Thank
flyer.
you so much, Majority.
Mm.
We host webinars every now and then, and on those webinars, we have other nurses who've been in the UK for longer, who've been through this experience, who can tell you what their experiences is like, and also who can testify to say, okay, this is what I did, this is what I did, this is what I think you should do. That's the power of that community. We have a share and learn session coming up on the 31st of January, which I think that's
That's
next
rich.
Friday.
Mhm.
Yes, it's free, and you just need to send us like a DM to get you registered. And of course, you have to join the community as well to be part of that webinar.
Mhm.
So if you're interested, we're going to be hosting a session on Friday at 8:30 p.m. We will have time to talk about, to ask, to answer all these questions, because those webinars run for like an hour, 30 minutes
Mhm.
ish. So it's an opportunity for you to come and
So
join
go
and see
and
if you can get
follow Safe Haven
even
community. Follow Ife
underscore
as
community.
well, but most
Yes.
especially go to the Safe Haven community. Yeah.
Yes. Go to the Safe Haven page,
Hmm.
and of course
Let's get you
we
started.
can get started from there.
Thank
Thank
you
you
so
so
much for your time.
much,
I
Geraldine.
sincerely
Thank you.
appreciate it.
We
Thank you
should do this
everyone for
again, though. I
listening.
mean,
We can take more
let's keep it on.
questions next time
We
because
can take
there's
more
still
questions, because there's
questions
a
on the
lot of questions that
screen.
I thought like
There's question in
we
the
could have
question
taken in
session,
that.
but we can't take everything.
Yes,
I'm going to
absolutely.
save this session so you can either watch it
Watch it
here or
later.
you can watch it on YouTube. I'll put it on YouTube as well. So that you can
Fantastic. That's fine.
pause and watch that kind of thing. You can listen to it while you're working. Just so, because I know a lot of people are asking questions that we already discussed, so that you
Yeah.
can go back and pick what you missed during the discussion. So we've come to the end of the live session. Thank you so much, guys. And I'll see you guys next time in another beautiful session. Take care.
Thank you. Thanks for
Bye.
that.
Enjoy
Take
the
care.
rest of your evening. Bye bye.